This is chest X-ray PA view, posterior view. This is a normal chest X-ray. Conclusion is normal chest X-ray. Why it is normal? Because the chest shadow, what we are seeing here, these all black shadows. This is right lung, this is left lung. And the middle shadow is the cardiac shadow. This is the trachea, clavicle, bones, rib cage. All you can see nicely. What is important is some markings you see in the. So, how do we discuss this upper zone, mid zone? This is the lower zone. Upper zone X-ray will describe how the lungs look like in upper zone, mid zone, lower zone. So once we start chest X-ray reading, we see that X-ray, the view is chest X-ray PA view, and skeletal, clavicle, ribs, they look normal. Cardiac shadow, this is the cardiac shadow, this is heart shadow, this is normal, it's not enlarged. If it is enlarged, it should have been from this to this side, very much enlarged. This aortic knuckle, so this is the left border of the ventricle, this is the right border of the heart. This is all black outside shadows is because of lungs. The lungs contain air. The middle part here is brachial artery, trachea, bronchus, all these so this is more, some more markings are there. Otherwise, they are normal. These are small or lung markings. This is about normal X-ray. So what is important here is you see the acute angle here, cardio, heart and phrenic diaphragm. Cardiophrenic angle. One is CP angle we call it. Costophrenic diaphragm angle. Very acute. So much acuteness. Here also this is. So CP angle is normal. It's not opacity is no opacity is there. Diaphragm semilunar, both sides normal. Cardiac shadow is normal. So chest X-ray, upper zone, mid zone, they are normal. So absolute chest X-ray PO is the normal view. Section number 6, this is normal X-ray. Let us have the look. Yes. The cardiac shadow is normal. You can see heart is just normal. But you see, focus on upper zone, both sides, and mid zone, right? Upper zone, then mid zone and lower zone. Left side, right side. What you see is ill-defined opacity is here. It's opaque. Both sides, this opaque, ill-defined, infiltrative lesions, upper zone, extending up to the part of the mid zone. And what is interesting is beautiful cavity, circular shadow, with almost no lung tissue looks like. So left upper zone, one cavity is there, ill-defined shadows, both upper lobes or upper zones, ill-defined, irregular shadows. So is this abnormal X-ray? Whenever there is a lesion, both sides of the lungs, in upper lobe more so, infiltrative lesions and cavity most likely suggest pulmonary tuberculosis. So radiological diagnosis, both upper zone, infiltrative lesions, both sides of the lungs, and left side upper zone you find cavity. These are radiology remarks. Strong possibility of pulmonary tuberculosis. So this patient needs sputum for AFB and other things, lab diagnosis. Different X-ray now. What you see here is heart is, cardiac shadow is normal. Left side is absolutely normal. So the angle, costophrenic angle, cardiophrenic angle, they are very, very well. But the right side, what you see, CP angle is obliterated, you can't see CP angle. Homogeneous opacity from base to mid zone of the lung, and the upper border is more like concave. This is Ellis shape curve. This is typical of right-sided moderate pleural effusion. So CP angle here obliterated, and homogeneous, one density opacity seen up to this, right? So this is right sided moderate pleural effusion, and then once the pleural effusion is there, you have to discuss, you tap the fluid and find out the diagnosis. 3. What you see is cardiac shadow is absolute normal, trachea normal, all clear normal. Left side lung is absolute CP angle is normal, everything is normal. Right lung, the upper zone you find homogeneous density opacity, homogeneous opacity. Trachea shadow is like this. Homogeneous opacity, upper zone, right side, suggestive of possibility of right upper lobe pneumonia, because CP angle free, no effusion evidence of effusion is there. Left side normal, right side mid zone also normal, lower zone normal, most likely upper lobe consolidation pattern. So you talk about pneumonia in this case, consolidation. Number 4, yes, you see the cardiac shadow is normal. What you see, the both lungs opacities are there, ill defined opacities. Upper zone, mid zone, lower zone, left side, right side, all shadows, ill defined, irregular shadows. They are not homogeneous. And you find, if you carefully see, you may see some cavities also. Here one cavity like shadow, both zones. So most likely this is a radiocholic. What are the findings? This is abnormal chest X-ray, both sides, upper zone, mid zone, infiltrable regions are there, ill-defined shadows. One cavity, other side, left side, and most like this is possibility of pulmonary tuberculosis. Once again, extensive pulmonary tuberculosis. So you see once again, cardiac shadow is absolute normal, small heart, and both lungs, right, left. You can see the marking is there, left. You can make out. Upper zone, mid zone, lower zone, infiltrable regions are there. So also the right side, upper zone, mid zone, lower zone, infiltrable ill-defined lesions, opacities are there. A nice cavity you can see here, left mid zone. This is the radiological finding. Once again, this suggests bilateral, both lobes are involved. Most likely, this case could be pulmonary tuberculosis once again. Okay, bye. There it's Dr. Gattani. Take the note of it. Bye.